When can I have hooded upper eyelid surgery revised?
As a cosmetic oculofacial plastic surgeon who specializes in revision surgery for eyelid surgery complications, I often see people who've had upper eyelid surgery elsewhere and are dissatisfied. They are usually very upset and want a revision done right away to improve their appearance. Common complaints people have include feeling like they look too hollow or they look too different after surgery and now they just don't look like themselves. Some people feel like they still look like they're tired even though they've had upper eyelid blepharoplasty. Some issues are related to difficulty with closing their eyes from having too much skin removed. Eyelid surgery is amongst the top 5 most popular cosmetic surgery procedures every year. This means that a significant number of people who've had upper eyelid surgery unfortunately want to have a revision. Before pursuing a revision procedure, it's important to properly diagnose the issue, develop a treatment plan, and determine when a procedure should be performed. As far as an explanation as to why so many people objectively require revision, I have an opinion based on my experience. Residency training in the United States is hospital-based and paid for by Medicare. Medicare does not pay for cosmetic surgery training. Formal training in cosmetic surgery, such as facial cosmetic surgery, oculofacial plastic surgery, and general cosmetic surgery, takes place after completing a residency, and this training is referred to as a fellowship. It's been well documented in official specialty peer-reviewed journals that a plastic surgery residency, which is mostly hospital-based reconstructive surgery, does not provide adequate training in cosmetic surgery. Adding to this deficiency is the fact that surgery around the eyes have a direct impact on the functioning of your eyes. Recognizing this situation more than 50 years ago, the subspecialty of oculoplastic surgery was formally established. As an examiner for the American Board of Cosmetic Surgery, I can also attest to the importance of properly supervised formal training specifically in facial cosmetic surgery and general cosmetic surgery. No surgeon is immune to complications, but the more experience you have in a specialized area, the less likely you will have certain avoidable complications. I've helped a good number of plastic surgeons with eyelid complications. I've observed that oftentimes the reason for the complication is in part due to a cookie-cutter approach to eyelid surgery. For example, skin removal in the lower eyelid is performed routinely regardless of the anatomic variance in skin laxity, the support of the lower eyelid, and the prominence of the eyes. Consequently, people end up with lower eyelid retraction and ectropion. As far as what to do if there is an issue with upper eyelid surgery, let's start with something straightforward, such as the need for additional skin or fat to be removed. In my own practice, my approach is to allow for adequate time for swelling to resolve, so I can perform any enhancement procedure as precisely as possible. Generally, this means waiting for about 6 months or longer after the initial surgery. For patients who come to me and feel like their upper eyelids look too hollow, I usually suggest that we improve the appearance of this area by placing hyaluronic acid filler adjacent to the bone structure above the eye, allowing for some degree of minimal swelling that may be present. I'll be comfortable performing this type of procedure as early as 3 months after a patient underwent surgery. If someone comes in with a skin shortage of the upper eyelids, the priority is to protect the eyes from exposure and potential vision-threatening compromise of the cornea. If the eyes can be managed medically with lubricating drops and other modalities like taping of the eyelids at night, then I wait to allow for the skin to stretch, which is aided by blinking and massage. Typically, a skin shortage has to be addressed with a skin graft. This is performed again based on the need for eye protection, so timing is individually determined. Lastly, people come in after having an upper eyelid blepharoplasty feeling like they still look tired. Oftentimes, this is caused by a condition called eyelid ptosis. Ptosis occurs commonly because the muscle that lifts the eyelid, called the levator muscle, has stretched or detached, causing the eyelid to droop. Most plastic or cosmetic surgeons don't perform ptosis surgery. Surgeons like myself, trained in oculofacial plastic surgery, perform ptosis surgery more routinely. When I evaluate a patient for cosmetic blepharoplasty, I always make sure to identify the presence or absence of ptosis. By doing so, I'm able to address the ptosis and perform the cosmetic blepharoplasty so the patient has an optimal outcome. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.